So give us some examples of how you would work with someone in the early stages of thought replacement, and give us the flavor of how that might progress through the therapy.
What I really want to do is see if this client is capable of generating a couple of positive thoughts every day. And I will ask them right in the therapy session, if you were going to think about something today that was just fun for you to think about, what would it be? Mm-hmm. And early in therapy, people will say, what do you mean? I only have negative thoughts. Mm. I said, yeah, but if you're going to have a positive thought, what might it be? Well, my positive thought might be that this isn't the worst day I ever had. Uh-huh. So you're looking at their pull towards negativity initially. Uh-huh. And then I will coach them a little bit. I'll say, well, what do you like to think about? What do you like to do? What in your life might be pleasant for you? And I don't know, for you it could be thinking about a basketball game you're going to play, mm-hmm. and, you know, a recent good time you had mm-hmm. on the court, or you might think about going dancing and which place you want to go to this weekend, and review the various positives of different places to do what you like to do. Mm-hmm. I'll ask people to think about a movie they saw recently that made them feel good, or what they're going to eat for dinner, or what bike trail they want to ride their bike on this weekend, or what book they're going to read, whatever their interests are. I have one gal who came up with the idea that her thought replacement each week during the summer would be to replay her weekend golf game in her mind. So whenever because she's one of those rare people who plays golf who really loves it, mm-hmm. she would say, okay, I don't want to worry. I'm going to think about the tee off on the third hole. And boy, was that a beautiful shot. And I'm going to see it in my mind. And so she's just going to go to the golf course for a minute. And then everything else will just sort of, her mind will wander away down a different path. But it sort of depends for each client what that would be. Some of my clients object to the idea that they should have a positive thought when they're in their workplace, which is interesting because they're not worried about having negative thoughts. They can sit at their desk and worry all day, but the minute I suggest that they daydream for a minute, well, but I'm at work. I'm not supposed to do that. Mm-hmm. All right, then let's redirect your attention to your work. And so I'll talk with them about their job and how they could just pull back from worrying to working. And that's tricky if work is a generator of anxiety. Likewise, it may be tricky if you're worried about your kids to think about family life. So this is a lot about tweaking. You know, mm-hmm. what each individual's process is. And when we're talking about that stuff, you get their resistance.